And here we go. Welcome everybody to The Big Idea. I'm Dr. Jeffrey Hanna here at Clear Chiropractic. Today I'm going to be talking a little bit about something called cervicogenic dizziness. That is where you're feeling off balance, but it's because of what's coming in your neck. And this is a very controversial topic where there is still very limited evidence about what's going on, how it happens, and what you do. And I'm going to go through a new article here about probably one of the reasons why it is so controversial. And in this, and maybe this video is going to be geared a little bit more for healthcare practitioners, but always important that you're not going to just read the headlines, but that you're also going to actually read the entirety of the articles. You know, all of us can do this when we've got so much information from traditional media, from the internet, from social media. We're not sure, okay, what exactly to believe because there's so much stuff going on. So I'm going to take you through a little article that'll explain one of the reasons why it is your doctor, your practitioner may not be thinking that the neck is a significant component in terms of dizziness in the first place. Let's have a look. So here's the article. Is manual therapy effective for cervical dizziness? This is a systematic review and meta-analysis of randomized controlled trials. In other words, this is the highest level study that can be done where it's looking at all of the available research, the highest level research that is actually out there. So let's have a little read through here, and don't worry, I'm not going to read this whole thing. The aim of this review and meta-analysis was to evaluate the effectiveness of manual therapy targeting the upper neck and the global manual therapy interventions compared with a control or sham on dizziness impact, intensity, frequency, pain intensity, and neck disability. Now, let me show you the conclusion right here. There is low to very low certainty evidence indicating a difference in effectiveness between an upper cervical spine intervention and control or placebo treatments for improving the impact and dizziness intensity in patients with cervical-related dizziness. So if you read that at first glance, what does that mean? At first glance, you would think, oh, okay, the upper neck and doing specific treatments in that area, they don't have a lot of impact in improving or helping people with dizziness. But that's the irony of this particular article if you're reading the headline only. If you actually dig into it a little deeper, and I'm not going to go too much into depth, I'll give you the link for the research right here, but let me actually go back a little bit to the results. I don't have it highlighted, but I'll do it kind of here in the blue. 6 randomized controlled trials and 3 secondary analyses were included. So, our analysis revealed a statistically significant difference between manual therapy focused on the upper cervical spine and controller placebo for impact and intensity of dizziness. In other words, and it's a relatively small number of studies, that's an important point, relatively small number of studies say, yeah, if a person's getting dizziness and if it's coming from the neck, this is a really big deal. We need to be doing this. But the certainty of the evidence was downgraded to very low for pain intensity, low or very low for cervical range of motion and disability. And what they're saying is that, yes, we're seeing that treatment in the upper part of the neck, it seems to be making a difference, but because the evidence is so limited, we can't draw any grand inferences from it. And as I'm sure you can appreciate, those are two very, very different ways of interpreting the same data. In fact, if you were to go through this research article, and again, this one might be more academic, that's geared for people who are working with the cervical spine. So this is going to be upper cervical chiropractors. These are going to be vestibular physical therapists. These are going to be osteopaths. These are going to be people who are actively working with vestibular balance conditions and also the upper part of the neck. We need to be cautious about not just reading the headlines, but also being cautious not to assign grand conclusions from everything. But nevertheless, I'm going to jump into this article a little bit more here so that we can kind of break that down. Because if you are somebody who is experiencing dizziness and you're asking your practitioner, hey, do you think that this could be related to a problem coming from my neck? And they say, oh, no, that's too controversial of a subject. I don't think so. You at least want to have some backup so that you know, is this even possible in the first place? So here are some of the things that are worth your consideration. Again, I'm just going to highlight a few of these yellow portions right here in the discussion. So the results, so out of those articles they looked at, showed a statistically significant effect in favor of manual therapy applied to the upper cervical spine compared to sham or control interventions in reducing, zoom up there a little bit, the impact of dizziness and dizziness intensity. The meta-analysis compared it to global intervention to sham for the dizziness impact could only be performed and the results did not achieve statistically significant differences. In other words, that means that no, you need to be precise in how you are working with the neck and not just general mobilization, not whole body mobilization. That didn't seem to work. You have to be precise when you're dealing with the upper part of the neck. Now, here is the reason why they concluded or said it's only low or very low evidence. The assessment of the clinical trials reveals that neither participants nor therapists were blinded. Due to the nature of the interventions analyzed in the study, blinding was not possible. And this is a very common thing when people are working in clinical settings. Oftentimes, from an academic or a research perspective, you need to have all of these controls, and the practitioner doesn't know exactly what's going on. They don't know if they're doing effective treatment, non-effective treatment. That works great if you are dealing with drug trials. It doesn't work near as well. It's almost impossible to do when you are dealing with manual therapies, chiropractic, physical therapy, etc., etc. And due to the nature of the interventions analyzed in the study, therapist blinding was not feasible. Although this limitation may introduce potential bias and affect the quality of the study, it is important to note that it's not routinely done in clinical practice. That said, that's the reason why the researchers here had to conclude that we can't draw the grand inferences from things just yet. We need more data. We need more practitioners actually reporting on what we are finding in practice so that we can draw better conclusions. But nevertheless, they're pointing out, even though the evidence that we do have is relatively small, it shows, or it seems to be quite very promising. So they make a few other comments here as we would conclude this here. Previous studies have shown that combining localized cervical interventions with sensory motor training, so brain training, such as balance exercises, joint position error correction, and oculomotor training. These are things that I've talked about on plenty of other videos on vestibular disorders, cervicogenic dizziness on this particular channel here, can significantly improve cervical proprioception. That is the messages from your neck that go to your brain, that let your brain know where your head and where your body is in open space. And if there's ever a corrupted signal there, that can make a person feel, quite unfortunately, very off balance. Therefore, combining treatments, that is combining manual therapy of the upper neck plus targeted neurorehabilitation programs, so this could include balance training exercise and joint position exercise, could potentially offer greater benefits. So they conclude the local manual therapy has better results to improve the impact and the intensity of dizziness compared with global manual therapy. The level of evidence, though, downgraded due to possible biases found in the studies. In other words, that idea that we are not able to blind ourselves when we're working with physical patients. So when it comes to where are you getting your information, and I suppose maybe I should have led with this, but this is really the key takeaway here, that when you're looking for information about what needs to be done for your particular healthcare situation, always consider, number one, consider the source, but number two, Don't simply read the headlines. Actually dive into what is going on. And if you have a particular article that you come across and you have a trusted doctor in whatever field, ask them to have a look at it so that they might be able to translate some of the fancy informations, or put it into Grok or Chat GPT or something like that and ask it to translate it into English. Because there is oftentimes a difference between certain conclusions that we can draw from the academic standpoint versus the things that we are actually seeing in clinical practice, where, simply put, the academic world has not yet caught up with what's going on with people who are actually working, helping individuals who have dizziness or headaches or migraines or whatnot on the front line. So maybe a little bit more of a academic rant more than anything else here, but nevertheless, hopefully gives you some good information that if you do have some type of dizziness that's going on, and especially if you notice, I feel worse if I am turning my head in certain direction, that would seem to suggest something is not going on right here. And even though the evidence is limited in terms of what's been published, among the stuff that is out there, it's saying, hey, you need to look at the upper neck so that you can find a resolution, and not just being general about it. You need to be precise. So if you've enjoyed this video, please always make sure you do click that like button there. Feel free to share this with friends, family, if you think that they would benefit from it. And if you want some more information about the particular work that we do in our practice, you can go visit our clinic website, clearchirospokane.com. Thanks for watching. I'm Dr. Jeffrey Hanna here at Clear Chiropractic. Get well, live well, stay well.